Thank you so much. Thank you for your patience. Just to explain that I'm here in Jamaica, which is very interesting, and that's why I couldn't be there in person because I was presenting with a group of colleagues, which is very interesting. So hence the time difference and the where I am. So Northern Ireland is it's a very interesting nation. So we are part of the devolved nations in in the UK, but we have a history of conflict and division. Which I mean, this is a very very simplistic version, but our conflict was really based within has a tone of religion to that, and because of that, and this is stemming a sort of a vast history relating to colonization. So religion and by default spirituality are very socially difficult and divisive and strained concepts. So we have this sort of backdrop, cultural backdrop, but we also currently also have a very changing demographic. So we have an increase in people who are stating that they are of no religion. But this population is still very, very small. And we also have, whilst other maybe European nations have more ethnic diversity, we are still very, very white. So our division is very much Protestant Catholic, and we have a very small population of minoritized ethnic communities. So this is a very interesting, socially quite a challenging space whenever you think about spirituality and trying to bring that into healthcare and trying to bring that into the mix. So in social work practice, we talk about spirituality, key ideas around that, and we've already heard from speakers today talking about spirituality. Key ideas around that in terms of the literature are around meaning making, about purpose, people's sense of purpose in their lives, people's sense of well-being, and how that is embodied and articulated in their everyday lives, and potential practices associated with that. So rather than simply saying that we ascribe to, if you viewing it in religious terms, rather than saying I ascribe to a particular religion, that what are potentially the practices associated with that, and what are the, even if somebody is not ascribing to a particular religious entity and they're saying that they are maybe even atheist or agnostic, are there spiritual practices that they still engage with in their everyday lives? So it's trying to widen that exploration of spirituality beyond religion. This idea of connecting to others, so connecting to self, that inner sense of being, connecting to others, and this sense of something, potentially something beyond oneself, and however that is articulated. There is controversy in some of the literature around transcendence, awe, and the sacred, because there are some writers who say actually it isn't about transcendence or awe, or the sacred. So there is debate, and I'm sure all of you are aware of that debate as well. We then go into the space of cultural competence, and I suppose I alluded a little bit to that when I asked about the question about cultural competence, because certainly in the UK, a lot of the literature around spirituality is sort of explored in terms of diversity, in terms of minoritized communities. And whilst that is relevant and important, there's also a danger that it makes it an issue that is only relevant to minoritized groups and communities, and not actually, and there's a danger of being oppressive in both directions for multiple community groups, and there's also a risk of ignoring it or overlooking it as a part of, potentially as a part of people's common humanity and their common human being. And so in social work practice, we talk about there's an author who talks about critical spirituality. So actually engaging with spirituality in a critical manner, and engaging with the context, and engaging and really trying to problematize and explore it much more widely and much more in depth. So in my own, I'm just going to skip through that, sorry. In my own PhD, so I did my PhD a number of years ago, and I interviewed social work practitioners. So these are statutory social work practitioners in mental health teams. And I interviewed people with severe and enduring mental health conditions through a community and voluntary organisation. And I interviewed both groups about what their understanding of religion and spirituality, both in terms of their own lived experience for both practitioners and service users, and asking the social workers, about their views about it in practice, any sort of challenges around what that might look like. So really trying to engage with it in depth, and also asking service users about their own narratives and their own understandings of around spirituality in their lived experience of their mental health. And that can be both as a symptom of mental ill health, but also as an aspect of recovery. And really, I suppose there strong contradictions emerged. So while social workers recognized, and I mean, these were small samples, but what the social workers talked about really was a contradiction where they saw that spirituality and religion could be relevant for some people experiencing mental health conditions. They recognized that as potentially part of their identity, but from a cultural context piece, that they didn't bring that into the practice because of the cultural context in which they were practicing. So there was this contradiction and this clash between social work values and the context of practice. Service users also echo this contradiction, which isn't surprising, but given that they're all in the same social context. So for service users, they talked about the importance of spirituality and religion within their mental health narrative, but that they weren't actually given any choice by the practitioners about whether or not that this would be included in their care. So they weren't, it wasn't acknowledged within their care, and they weren't given choice or permission to talk about it. So there was this sense of lack of shared narrative building and lack of shared permission, and really fundamentally a lack of training and guidance about how we talk about religion and spirituality in the Northern Ireland context. And so, I mean, my PhD was 2016, and I returned to practice, and now I'm in this post in Queen's. And since then, sadly, there hasn't been further research in the Northern Ireland context about religion and spirituality within social work practice. So it's a very, very challenging context in which to try and broker dialogue and exploration about this, very much on a one-to-one basis with practitioners. They share interest and talk about it, but from a funding point of view or an education point of view, it still remains very challenging. These are some of the quotes that the mental health social workers talked about, okay? So I won't read all of them out, but really the themes that are being generated here, and I should say that not all 12 of the social workers didn't talk about it in their practice, but really only one did, and this was somebody who I think had engaged with their own spirituality and their own narrative and their own life experience, and that they were a confident practitioner. They were a long established practitioner, and so felt very comfortable engaging with these aspects within their practice. But for the rest of the practitioners, you can see the sort of quotes that are talked about there. And so you see, it's important, I suppose, to state that this isn't all about the Northern Ireland context. We have issues of secularization creeping in here as well. So this idea of people don't go to church, don't go to mass anymore. So, and it's only relevant for minority ethnic groups. Therefore, it's not relevant to our white population. And so this is a very, very narrow conceptualization of religion and spirituality within people's lived lives. But you see themes of worker avoidance, and this idea of sussing out. So this is the very much the Northern Ireland lens, where people will be trying to work out if you're Protestant or you're Catholic, and that will then dictate, or that will, that sort of behavior or practice will then prompt people to avoid, because they don't want to bring that political aspect into their practice. But we also see this idea of power imbalance. So workers will say, well, yes, I'll talk about this if the service user talks about it, but that really fundamentally ignores the inherent power imbalance that is present within social work practice. And as practitioners, we might try and do as much as we can to rebalance that, but it is an unavoidable truth and an unavoidable aspect of practice that power imbalance is there. And then it's too fraught. There's too much cultural political baggage around it, so I don't talk about it in my practice. Okay, time goes quickly when you're presenting. And here we have some of the service user quotes. Okay, so I'm treated like I'm mad. Again, some of these are very much Northern Ireland lenses, but we also see some themes around the idea of mental ill health and spirituality and that demonization and that stigma that is associated with it. Um, Crucially, I think some of the service users talked about they want to keep it outside of mental health. They want to keep it private. But we also see that some of them said, the worker doesn't respond to maybe my initiating a queue. So if we think about the power imbalance piece that the workers talked about, in this we see that those service users aren't going to talk about it because the workers aren't picking up the cues, or they've got anxieties about how it's going to be treated and how it's actually going to be handled, i.e. that it could be used as a viewed as a symptom of mental ill health if they did disclose it. So a lot of these quotes, a lot of these views, sorry, are very, very powerful in thinking about this sort of the tensions that are present within this. Whenever we look at the social work global standards from International Federation of Social Work, these are two sort of standards that I've pulled out. So we can see that social work, social workers are meant to be trained in traditions, cultures, beliefs, religions, and customs, typo error there, and how that impacts human development. And we also have a duty and an expectation to prepare students to understand how social determinants may impact a person's health and well-being, and that includes their spirituality. To my mind, on reflection, certainly looking at my own context and practice, I don't see this happening, and I don't see social work students necessarily being prepared and being trained to try to begin to think about these aspects of identity and these aspects of well-being within their social work practice and what that might look like in different areas of practice. There's a literature review done by Bambando et al. And this was looking at religion and spirituality. It's a literature review looking at spirituality and religion within social work practice from 2008 to 2021, and they identified 255 articles. And you can see the themes that were being generated. So about religion, religious sensitivity and social work practice, looking at social work education, looking at secularization, looking at this idea of East meets West, and that was muted there whenever somebody talked about mindfulness, and this idea of convergence and divergence of social work values. Interestingly, I think in this article, I think the way that they conceptualized religion and spirituality was very much heavily swayed towards religion, and I think there's a danger sometimes where the terms become conflated when actually they are related, but they are different terms. And so this literature, whilst it's useful and helpful, there are some queries around it that I would propose. So within my own literature, I am now, I suppose, in a position at Queen's where I'm beginning to think about, well, how do I raise consciousness? How do I begin to try and raise awareness about spirituality within social work practice and try to acknowledge the cultural context of Northern Ireland in terms of our conflict history, but also to make it much, much wider than that. So to make it about all around cultural competence. And we all have our own culture. It's not as something that is relevant to another person that maybe looks different to us, but actually we all have our cultural competence that we all need to be tuned into. And so trying to highlight that the importance of preparing students to try and acknowledge that part of identity with whoever they are working with, and being willing to ask those questions and engage in a dialogue with people regarding their spirituality and within the care and the support that they are receiving. So I've developed a survey with undergraduate final year students in Queen's and at our neighbouring our institution as well, to really try and engage with what their idea of spiritually competent practice and their understanding of spirituality. So really it's about asking what they understand spirituality to be, but also then thinking about, well, what does this look like in your practice day to day? And is it something that you've actually been able to engage with, particularly as these students are coming out of their final year placement? So I've talked, these are some of the sort of drawing the themes together. So this idea of diverse spiritualities, cultural and spiritual competence. There's my timer. Ethical issues, so these professional boundaries that emerge and some of the controversies and strains around that. Edward Taylor in Canada talked about that need for social work to have open dialogue about spirituality and social work practice, and actually what that means out with a North American context. And Ranner already talked about that as well, I think. Inclusive practices, definitions and practices around spirituality, education and training, research, the context of practice, and the central voice of service users within that. I'm just going to have my email up there if and I would love, I would love to have been in at the conference. I was so excited, but because I was part of this group to come to hear and to do this presentation. So I would, if there's anybody's interested, I've just put my email up there, just if anybody was interested in connecting beyond this virtual space. So thank you so much for your time. I've tried to keep to my 15 minutes just, so thank you.